Bob.
Yes, good morning, Lee.
So, last episode we talked about phytoestrogen and we mentioned a little bit of fatty liver. So, um, how this fatty liver uh, happens to so many people, even people are not overweight. I think one of the reason is the processed food. So I think when you were young, you probably eat a lot of processed food, right?
I think so, yes.
Yeah, from
It's fast and it's easy to consume, so, having a better diet, consumes a lot of time to eat properly. So maybe that's why I went to a lot of processed foods, sausages and different things, hot dogs, that would be easier and faster to consume.
yes, and the other thing is fructose really stimulate the brain. It's very fast absorbed. So when you were 30s, you can burn out all the calories it provide. You're exercise, you're physically active. But when we get certain age, our metabolic level dropped. If we don't change the diet, then all the extra calorie will be accumulating and converted to fat tissue. So I have patients who was diagnosed as fatty liver, not related with alcohol. It's called non-alcoholic fatty liver, but it does influence the liver function. And they took herbs, and after it's not a one-day job because you have to change the whole metabolism in order for the body to absorb those extra fat. But your liver function is normal, right?
Yes.
Yes. I think you also you took a statin, but by changing the diet, you were able to lower the statin medication from what 80 milligram.
Well, the lowest dosage that I can get from the VA is 40 milligrams, and I'm able to cut that in half. So once a day, I take 20 milligrams
So 20
of the
milligram.
torvastatin.
Yeah, torvastatin.
Yeah.
So that will keep the balance that you were not told that you have plaque in the carotid artery and your cholesterol is normalized. And last time you mentioned that also your kidney function is improved. So the protein content is lowered, and your EGFR jumped from 60 to what, 80 or
84.
yeah, at your age, that's a very good range.
Mm.
Now, the next step, we want to, if you're interested, we can use some herbs to gradually make the body absorb the fat from different area. So I searched the literature in Journal of Gastroenterology, and they actually did a study for different kind of a formula and see how that will influence the fatty liver. By taking those herbs, will change the certain enzyme activity so they can break down the fat tissue. So not only that, it's also it's lowered the free fatty acid in the blood, and that will prevent the future blood clots, thrombosis, or stroke. So these herbs are formula. So we have different herbs to target different organs. We call it the main herb is the main herb targeting the main problems, and the other assisting herbs will help the others, not the main symptoms, the other symptoms. And then we have the herbs lead the other herbs, the main herb, to your different organs. Like if we want to target the liver, we have certain herbs to lead all the herbs to liver. And we want to target your kidney, we have other herbs to target the kidney. So usually we use a formula, so that will enhance the main therapeutic effect, but it also reduce possible side effect. So I am a herbalist, and if I took herbs, I will not take one single herb for long term. You can take one herb for a short period of time, but not for a long time. That will cause other issues.
Well, if I take atorvastatin for many years of usage, I've probably been taking atorvastatin even earlier, higher doses. It's only been maybe the last 5 years that I've lowered the doses, but I've been taking atorvastatin for 25 years. So taking that long term can cause what side effects to my body?
So there are a lot of clinical cases indicating that it could damage the kidney, but at lower dosage you may have less effect, and also it could make muscle weak. So some people take that and develop hip pain or shoulder pain. Depends on which area is weaker. Like people who have lower back pain all the time, then if the muscle is weaker, by lower the cholesterol to very, very low level, then your muscle, the cell of the muscle, the wrapper, the cell memory will not be so strong because the main ingredient is cholesterol. So there is a balance there. You need to lower the cholesterol to prevent the blood clots, but also if it's too low, testosterone is lowered, and then the memory of the nerves, the muscle membrane are all kind of become weaker, and that can also linked with neuropathy. But you have already take that for so long, you haven't had the tingling or pins and needles, so you don't have neuropathy. So I think the 20 milligram probably is your dosage.
Mm-hmm.
Of course, if you can lower to 10, that'll be even better, but you have to balance that.
Okay, should I add along with the atorvastatin an herb?
I think that should be fine, but you just separate them, and you can take that for like say 1 or 2 months and get the triglycerol, total cholesterol, or liver function checked, and also you can do the ultrasound or the MRI, CT scan to see if there's any changes there.
Okay. All right, thank you.